Hello, everybody. Assalamualaikum. Welcome back to our nursing licensure exam review. And last night we ended up here, and today we are going to continue from where we left off. Once again, this is Hannah, and this is my journey to the top one preparation for the 2023 Nursing Board Exam Review. Okay, so, question number two, Bismillah. Ronald plans to conduct a research on the use of a new method of pain assessment scale. Which of the following is the second step in the conceptualizing phase of the research process? Review of related literature, design the theoretical and conceptual framework, formulating the research hypothesis, and formulating and delimiting the research problem. So we're talking about planning to conduct a research on the use of a new method of pain assessment scale. I think it's a research problem. Oh no, it's a review of the related literature. Okay. After formulating and delimiting the research problem, the researcher conducts a review of related literature to determine the extent of what has been done on the study by the previous researcher. So this is already a research problem. Okay, but when we conduct a research, the first thing to do is to formulate and delimit the research problem. So this is what I answered. But anyways, it is wrong. That is why the reason for that is because this is already a research problem because the Ronald has already determined what he wanted to study. So the next step is to review the review of related literature because review of related literature provides you with the overview of what has been previously studied and what areas need to be studied further. Next up, asking the questions to determine if the person understands the health teaching provided by the nurse would be included during which step of the nursing process. Okay, asking questions to determine if person understands it is evaluation. So evaluation includes observing the person, asking questions, and comparing the patient's behavioral responses with the expected outcomes. Next question. Nurse Myrna is providing instructions to a nursing assistant assigned to give a bed bath to a client who is in contact precautions. Okay, contact precautions. Nurse Myrna instructs the nursing assistant to use which of the following protective items when giving bed bath? Gloves and goggles, gown and gloves, gloves and shoe protectors, gown and goggles. Remember, the one who is in contact precautions is the client. Okay? So gloves is the most important thing here. So gown and gloves, since this is a bed bath, contact precautions require the use of gloves and a gown if direct client contact is anticipated. Goggles are not necessary unless the nurse anticipates the splashes of blood, body fluids, secretions, or excretions may occur. Shoe protectors are not necessary. Okay? Next one. A male client is being transferred to the nursing unit for admission after receiving a radium implant for bladder cancer. I see. So the client is being transferred for admission. So there has been a radium implant for bladder cancer. Okay. The nurse in charge would take which priority action in the care of this client? So which kind of action will we take if we are the nurse in charge? Remember, there's this radium implant, okay? Number one, encourage the client to take frequent rest periods. First of all, I have to Google what radium implant is because I think it's my first time to encounter it. Okay, so accordingly, a radium implant is a type of radiation therapy in which radioactive material sealed in needles, seeds, wires, or catheter is placed directly or near into the tumor, also called brachytherapy, internal radiation therapy. I see. So this is like a chemotherapy, radiation therapy, but it's inside the body. Okay. So encourage the client to take frequent rest, admit the client to a private room, place client in reverse isolation, Encourage family and friends to visit. No, we cannot encourage family and friends to visit. This is radiation, remember? And the patient is undergoing through immunodepressant therapy. So this is not a choice. Admitting the client into a private room, placing the client. I'm having a thought between these two. So let's talk about private room and reverse isolation. So a reverse isolation is something that um, is a measure of how well a signal applied to the device output is isolated from its input. Reverse isolation hospital. Okay, so I think it's a reverse isolation. We'll see. Oh no, it's private room. I see. Okay, private room. So I was doubting about this too. Let's hear about the explanation. So the client who has a radiation implant is placed in a private room and has a limited number of visitors. This reduces the exposure of others to the radiation. I see. Okay, I see. So it protects others and it protects the patient. So reverse isolation is only for those immunodepressant, like for chemotherapy and for private room because of the radiation implant. Okay, now. The physician prescribes meperidine demerol 75 milligrams intramuscularly every 4 hours as needed to control the client's postoperative pain. The package insert is meperidine 100 milligrams per ml. How many milliliters of meperidine should the client receive? Okay, we're talking about ml. So we are going to solve this. So first of all, the formula for this, if I remember, is the drug to be administered is equal to the uh, desired dose over dose on hand, multiply it by the volume. Okay, so the desired dose is 75 milligrams and the dose on hand is 100 milligrams. So we basically divide 75 divided by 100. Okay, let's grab a calculator. Grab your calculator. 75 divided by 100. That is equivalent to 0.75. And the volume, remember this per ml, we have 1 ml of volume. Okay, therefore we have 0.75 times 1 ml. That is equivalent to 0.75. Okay, let's see. That is correct. So to determine the number of milliliters the client should receive, the nurse uses the fraction method in the following equation. Okay, anyways, we already understand that the dose to be administered is equivalent to the desired dose divided by the dose on hand times the volume, okay? Okay, now, alhamdulillah. Now, a newly admitted female client was diagnosed with deep vein thrombosis. Okay, this is a deep vein thrombosis. Which nursing diagnosis should receive the highest priority? Okay, let's see. Impaired gas exchange related to increased blood flow, ineffective peripheral tissue perfusion related to venous congestion, excess fluid volume related to peripheral vascular disease, risk for injury related to edema. This is the least priority action that you need because it's only a risk diagnosis. But anyways, going back to our ABC priority, we have airway, breathing, and circulation. So this one is talking about airway. This one is talking about circulation. This one as well. So we'll see if it is this one. Oh no, it's about ineffective peripheral tissue perfusion. Let's see. So ineffective peripheral tissue perfusion related to venous congestion takes the highest priority because venous inflammation and clot formation impede blood flow in a client with deep vein thrombosis. That is true. That is very, very true. This is why it's so important to understand these facts of what a deep vein thrombosis is. So a deep vein thrombosis is is it occurs when a blood clot forms in one or more of the deep veins in the body, usually in the legs. Deep vein thrombosis can cause leg pain or swelling. Sometimes there are no noticeable symptoms. So, ineffective peripheral tissue perfusion related to venous congestion. If there is no more blood being supplied to a tissue, it can impede the blood flow and it can cause serious complications. Now, another one. Nurse Jana is monitoring the ongoing care given to the potential organ donor who has been diagnosed with brain death. The nurse determines that the standard of care had been maintained if which of the following data is observed. Okay? Serum pH of 7.32, blood pressure 90.48 mmHg, that is very low. Capillary refill of 5 seconds is very low. Urine output, capillary refill of 5 seconds is so slow. This should be 2 seconds. Within 2 seconds, urine output 45 ml per hour. So we know for a fact that a normal urine output of an adult is 60 ml per hour. So let's see the serum pH. I want to know the normal range for serum pH. 7.35 to 7.45. This is 7.32. Okay, I see. The blood pressure is too low. Capillary refill is too slow. So these ones we are now going to be uh we're now going to disregard this. So we're talking about the urine output and the serum pH. So urine output 45 ml per hour. Let's see if it is still in the normal. It really won't give you any results. This is normal. This one is almost normal. So this is potential organ donor. I'm not sure, to be honest, if it's the pH or the urine output, but I think it's the pH. But I think it's the urine output. Let's see. Oh, it's correct. It's the urine output. So, adequate perfusion must be maintained to all vital organs in order for the client to remain visible as an organ donor. A urine output of 45 ml per hour indicates adequate renal perfusion. That is true. Therefore, there has been a healthy perfusion of the tissue there, of the organ to be donated. Low blood pressure and delayed capillary refill time are circulatory system indicators of inadequate perfusion. A serum of pH of 7.32 is acidotic, which adversely affects all body tissues. So this is already acidotic. It's low, so the normal range is 7.35, and that 0.3 difference makes the difference, right? Okay, now let's try another more question. Nurse Meredith is in the process of giving a client a bed bath. In the middle of the procedure, the unit secretary calls the nurse on the intercom to tell the nurse that there is an emergency phone call. Okay, the appropriate nursing action is to cover the client, place the call light within reach, and answer the phone call. Immediately walk out of client's room and answer the phone call. No, don't do this. Leave the client's door open so the client can be monitored and the nurse can answer the phone call. No, don't do this. You're giving a client a bed bath. Finish the bed bath before answering the call. So the best thing to do is to cover the client, place the call light within reach, and answer the phone call. Okay? Right. Because telephone call is an emergency, the nurse may need to answer it. Then the other appropriate action is to ask another nurse to accept the call. That is true. I've encountered that kind of problem before, and this was the option. So, however, it's not one of the options. Okay, so it's not among here. To maintain privacy and safety, the nurse covers the client and places the call light within the client's reach. Additionally, the client's door should be closed on the room or the room curtains pulled around the bathing area. Now let's proceed to another question. Nurse Ronald is aware that the best tool for data gathering is 1. Use of laboratory data, questionnaire, observation, and interview schedule. Best tool for data gathering. So if we talk about the best tool among the options here given, I would say that the laboratory data is the best because you have the you have the accurate data sample results. And for interview schedule, observation questionnaire, because accordingly, let's try to Google most reliable data gathering, data collection method. Interview is the most reliable one. But we have here the use of laboratory data. So this is actually a factual data that you can use. So we have between interview and use of laboratory data. So let's see if it's interview. Oh, it's the use of laboratory data. I shouldn't have done that. Okay, incidence of nosocomial infection is best collected through the use of biophysiologic measures, particularly in vitro measurements, hence laboratory data is essential. I should have answered that. Okay, that was like the strongest answer that I had. Okay, next one. A male client is receiving total parenteral nutrition suddenly demonstrates signs and symptoms of an air embolism. So what is an air embolism? An air embolism is called gas embolism occurs when one or more air bubbles enter a vein or artery and block it. So when an air bubble enters a vein, it's called venous air embolism. When an air bubble enters an artery, it's called an arterial air embolism. So an air embolism is when an air bubble gets stuck in the vein or artery. Okay. Now, priority action. Place the client on the left side in the Tredelenburg. Place the client in high Fowler. Stop total parenteral nutrition. Notify the physician. Let's stop it. Oh no, place the client on left side. I've been getting it wrong. Okay, so let's see the explanation. Lying on the left side may prevent air from flowing into the pulmonary veins. Okay. The Tredelenburg position increases intrathoracic pressure, which decreases the amount of blood pulled into the vena cava during aspiration. So Tredelenburg. Tredelenburg position is actually left side in the Tredelenburg position. It's actually like an upside down, not upside down actually, but like you kind of twist around 45 degrees the body, you twist it. So like you lay back. Okay. So lying on the left side may prevent air from flowing. Okay. Let's hear. A client is admitted with multiple pressure ulcers. When developing the client's diet plan, the nurse should include, we're talking about multiple pressure ulcers, right? Ground beef patties, fresh orange slices, ice cream, steamed broccoli. Pressure ulcer, we're going to need fiber. So So in order to have the diet for low-fat versions of foods, oh, okay, let's try broccoli. Ground beef patties, protein. Meat is an excellent source of complete protein, which this client needs to repair the tissue breakdown caused by pressure ulcers. Okay, meat. Oranges and broccoli supply vitamin C but not protein. That is true. Ice cream supplies only some incomplete protein, making it less helpful in tissue repair. Now, next one. I keep on getting low and low score. I'm scoring 56% for now. Okay, the female client was recently admitted. She has fever, weight loss, and watery diarrhea is being administered to the facility. While assessing the client, Nurse Hazel inspects the client's abdomen and notices that it is slightly concave. Additional assessment should proceed in which order? Palpation, percussion, auscultation, auscultation, percussion, palpation. So first of all, if we do the assessment. First of all, auscultation should come first, and then we percuss, and then we palpate. Let's see. Right, that is correct. Okay. The correct order of assessment for examining abdomen is inspection, auscultation, percussion, and palpation. The reason for this approach is that the less intrusive techniques should be performed before the more intrusive techniques. Percussion and palpation can alter natural findings during auscultation. Next one. Marion is aware that the sampling method that gives equal chance to all units in the population to get picked is called random. That is correct. Random sampling gives equal chance for all the elements in the population to be picked as part of the sample. Now, there are also it's fun that there are also research questions here, not just purely like nursing questions. Okay, next one. When the method of wound healing is one in which wound edges are not surgically approximated and integumentary continuity is restored by granulations, the wound healing is termed. Okay, so the key word here is the granulations. Granulations are like the pink, like the pinkish layer of covering on the wound. Okay. First intention, primary intention, third, or second intention healing. So I kind of remember this, but I'm trying to. I mean, I forgot it already. I'm trying to remember. Yeah. So they're not surgically approximated, restored by granulations. Oh, it's correct. Second intention healing. So when wound heals, they will allow to heal by secondary intention. So the thing is, the primary intention healing, what it does is that the wound edges are surgically approximated and there are no granulations yet. But second intention healing is when it is not approximated and the integumentary is restored by granulation. Next one. Nurse Trish is caring for a female client with history of GI bleeding, gastrointestinal bleeding, sickle cell disease, and a platelet count of 2,000 per uh, ml. Okay, 22,000. We're talking about 22,000. Okay. Okay, 22,000 is already very low. Okay. The female client is dehydrated and receiving dextrose 5% in half normal saline solution at 150 ml per hour. The client complains of severe bone pain, is scheduled to receive a dose of morphine sulfate. In administering the medication, nurse Trish to avoid which route? Okay, there's a history of GI bleeding. The client is dehydrated. Oral? Oh, you should avoid IM. With a platelet count of 22,000, the clients tend to bleed easily. That is true. Therefore, the nurse should avoid using the IM route because the area is highly vascular and can bleed readily when penetrated by a needle. The bleeding can be difficult to stop. That is right. So we take note here of the platelet count of 22,000. So, yeah, there's a risk. There's a risk for bleeding at IM. Next question. A male client who has severe burns is receiving H2 receptor antagonist therapy. The nurse in charge knows that the purpose of therapy is to prevent stress ulcer, block prostaglandin synthesis, facilitate protein synthesis, enhance gas exchange. Honestly, I don't really know. But I used to have a medicine of H2 receptor antagonist because I used to have gastritis. So I want to know the mechanism of action of an H2 receptor antagonist. What it does is that it um it blocks. Let's just try this. Prevents stress ulcer. I used to have gastritis, so this is very related to ulcer. Curling's ulcer occurs as a generalized stress response in burn patients. Yeah, I do have that, to be honest. This results in a decreased production of mucus and increased secretion of gastric acid. The best treatments for this prophylactic use of antacids and H2 receptor blockers. Let's try another one. Which of the most appropriate nursing action is in obtaining a blood pressure measurement? By the way, guys, we're only going to be answering another 30 questions for today. Last night we had 30 questions answered, and tonight is another 30, so therefore we will end at 60 questions. Okay, which is the most appropriate nursing action in obtaining a blood pressure measurement? Which is the most appropriate? Have the client recliner sit comfortably in a chair with the form at the level of the heart. Measure the client's arm if you're not sure the size of cuff to use. Take the proper equipment, place the client in a comfortable position, record appropriate information in the client's chart. Document the measurements with which extremity was used and the position the client was during. Okay. No. I'm doubting between A and C, so C is the correct answer. Alhamdulillah. It is a general or comprehensive statement about the correct procedure and includes the basic ideas which are found in other options. That is true. So this is the general idea of how to take a blood pressure. Next one. A 10-year-old child with a type 1 diabetes develops diabetic ketoacidosis and receives a continuous insulin infusion. Which condition represents the greatest risk to this child? So this is a diabetic ketoacidosis. Hyperphosphatemia, hypercalcemia, hypernatremia, or hypokalemia. Okay. So when you have diabetic ketoacidosis, mm, right. Insulin administration causes glucose and potassium to move into the cells, causing hypokalemia. Next one. The physician orders TS 50 cc with potassium chloride 10 MEQ per liter at 30 cc cubic per hour. The nurse in charge is going to hand 50 cc 500 cc bag. Potassium chloride is supplied at 20 and how many cc of. Okay, so we are going to solve the problem for this one. This is the order, and this is the on hand product. So I'll try if I still remember how to compute for this one. 1.5. Let's see, I'm not sure. Oh, it's 2.5. 2.5 cc's to be added because only a 500 cc bag solution is being medicated instead of 1 liter. Oh, that is true, yeah. You know? When caring for a male client with a 3 centimeter stage 1 pressure ulcer on the coccyx, which of the following actions can the nurse institute independently? Applying an antibiotic cream to the area 3 times per day, using normal saline solution to clean the ulcer and applying a protective dressing as necessary, massaging the area with astringent every 2 hours using povidone iodine. So this one. Using normal saline solution. Washing the area with normal saline solution and applying a protective dressing are within the nurse realm of interventions and will protect the area. Using a povidone iodine wash and an antibiotic cream require physician's order. That is true. Massaging with an astringent can further damage the skin. That is true also. Next one. A male client with diabetes mellitus is receiving insulin. Which statement correctly describes an insulin unit? It's a common measurement in the metric system. It's the smallest measurement in the apothecary system. It's a measurement of effect, not standard measure of weight of quantity. It's the basis for solids in the avoirdupois system. So the units of the insulin is not a very common unit actually. It's the measure of effect, not standard measure of weight of quantity. Okay. Insulin unit is measure of effect, not a standard measure of weight or quantity. Different drugs measured in units may have no relationship to one another in quality or quantity. That is true again. Okay. A male client has the following arterial blood gas values. Okay, I hate this kind of questions. I really don't like these kind of questions. pH 7.30 is acidic. PaO2, potassium oxide 89 mmHg. Okay, so we know that it is acidosis, but we're not sure if it is respiratory or metabolic. It's respiratory. I see. The client has a below the normal acidic blood pH value and above normal partial pressure of arterial carbon dioxide value, indicating respiratory acidosis. In respiratory alkalosis, the pH value is above normal and the PaCO2 value is below normal. In metabolic acidosis, the pH and bicarbonate values are below normal. Oh, I see. So if we're talking about metabolic, we're only considering H hydrogen carbonates and the pH. Whereas if we're talking about respiratory, we're talking about PaO2 and the pH. So if the pH is below normal and the PaO2 is above normal, it is respiratory acidosis. If the pH is above normal and PaO2 is below normal, it is respiratory alkalosis. And if the pH is below normal and the H hydrogen carbonate is mm, below normal too, it is metabolic acidosis. In metabolic alkalosis, the pH and HCO3 values are both above normal. So HCO3 normal range is 22 to 26. 22 to 26. This one is normal. So PaO2, normal range, 75 to 100. This one is 89. This one is 50. So it's below it actually. For respiratory acidosis. Okay then. Which stage of pressure ulcer development does the ulcer extend into the subcutaneous tissue? Now, talking about subcutaneous. Is it stage 1? It's stage 3. Clinically, a deep crater without undermining of adjacent tissue is noted. Cutaneous ulcer. Okay, I got it now. Next one. Stage 1 is all just in the epidermis. Stage 2 dermis. Stage 3 subcutaneous and stage 4 in the tissue already. Okay. Now we're talking about digoxin. Dr. Garcia writes the following order for the client has been recently admitted digoxin 125 milligrams PO once daily. To prevent dosage error, how should the nurse document this order onto the medication administration record? Okay, digoxin. Okay, we're talking about 0.125. Okay, we're talking about this one 0.125 milligrams PO once daily. What's the difference? Okay, this one. So it's correct. The nurse should always place a zero before the decimal point so that no one misreads the figure, which could result in dosage error. The nurse should never insert a zero at the end of dosage that includes a decimal point because this could be misread, possibly leading to a tenfold increase in the dosage. Now, next one. Nurse may attend an educational conference on leadership styles. Okay? The nurse is sitting with a nurse employed at a large trauma center who states that the leadership style at the trauma center is task-oriented and directive. The nurse determines that the leadership style used at the trauma center is autocratic. Autocratic style of leadership is a task-oriented and directive. That is true. I remember reading about that. Now, the nurse is assessing a 48-year-old client who has come to physician's office for his annual physical exam. Okay, 48-year-old client. One of the first physical signs of aging is failing eyesight, especially close vision, having more frequent aches and pains, accepting limitations while developing assets, increasing loss of muscle tone. No, failing eyesight is the first one. Failing eyesight, especially close vision, is one of the first signs of aging in middle life, ages 46 to 64. More frequent aches and pains begin in the early late years, 65 to 79, and increase in loss of muscle tone occurs later year, 80 and older. I'm so sorry for answering that. Okay, now, again, eyesight is the first sign. Okay, nursing care for female client includes removing elastic stockings once per day. The nurse, Betty, is aware that the rationale for this intervention to increase blood flow to the heart, observe the lower extremities, allow leg muscles to stretch and relax, veins in the legs to permit veins in the legs to fill with blood. Observe lower extremities, allow leg muscles to stretch and relax. Okay, so observe the lower extremities. Elastic stockings are used to promote venous return. The nurse needs to remove them once per day to observe the condition of the skin underneath the stockings. Applying the stockings increases blood flow to the heart. While the stockings are in place, the leg muscles can still stretch and relax and the vein can be filled with blood. So that's it. Now, next question. When the license of Nurse Karina is revoked, it means that she may apply for reassurance if it's her license based on certain conditions. No longer allowed to practice profession for the rest of her life. Okay, the license has been revoked. I'm not sure about this, but I think you can once again apply for it. That's right. So, Republic Act 9173, Section 24 states that for equity and justice, a revoked license may be reissued provided that the following conditions are met. The cause for revocation of license has already been corrected or removed. At least 4 years have elapsed since the license had been revoked. Now, the nurse in charge in labor and delivery unit, by the way, this is going to be the last one for today. It's the 60th question. I know it's not already. It's the 58, 59 question. Not yet the 60 yet, because accordingly 58 or 100. Okay. The nurse in charge in labor and delivery unit administered a dose of terbutaline to a client without checking the client's pulse. So to remind you, a terbutaline is actually used to prevent and treat wheezing, shortness of breath, and chest tightness caused by asthma, chronic bronchitis, and emphysema. Terbutaline is in a class of medications called beta antagonists. It works by relaxing and opening the airways, making it easier to breathe. So the standard that would be used to determine if the nurse was negligent is physician's order, action of clinical nurse specialist who is recognized expert in the field, actions of reasonably prudent nurse with similar education experience, The statement in the drug literature about administration of terbutaline. No, actions of reasonably prudent nurse. Okay. Standard of care is determined by the average degree of skill, care, and diligence by nurses in similar circumstances. Now, this is the last questions that we're going to answer. Nurse Amy is aware that the following is true about functional nursing. Concentrates on tasks and activities, 1-to-1 patient ratio, provides continuous, coordinated, and comprehensive nursing services, emphasize the use of group collaboration. What is a functional nursing anyway? Functional nursing. Can I find it in Google? Functional nursing is a nursing model that focuses on efficiency and getting as many tasks as possible done in the shortest time. It is task-oriented and involves giving a particular nursing function to each worker. It's often helpful model in hospitals with deficiency registered nurses. Okay. Oh, provide continuous, coordinated, and comprehensive nursing services. Functional nursing is focused on tasks and activities, not on the care of patients. So that is the last one. And for this question, another 30 set of questions for tomorrow. Thank you guys so much for reviewing with me, and I hope that we make our journey to the top one. Thank you. Bye bye.